Hi, my name is Crystal, and this is my obsessive compulsive disorder, also known as OCD, presentation. Obsessive compulsive disorder, or OCD, is when a person has frequent fears or obsessions that cause a pattern of repetitive behavior. These obsessions often can interfere with everyday activities and cause distress. Causes of OCD in children. Brain structure. Studies have shown a correlation between OCD within the frontal cortex and subcortical structures in the brain. Early life trauma. Studies have shown that children who experience early traumatic events such as abuse or sexual assault can result in having symptoms of OCD. Genetics. There is no specific OCD gene, however, there has been evidence that has shown how common it is for OCD to run in families. Stress. Stress from relationships, school, and illness can factor into what triggers OCD symptoms. Who is affected? 2 to 4% of the population have OCD, 1 to 3% in boys, 0.5 to 2% in girls. In children, OCD symptoms typically start to show between the ages of 8 to 12 years old. In adults, OCD symptoms typically start to show between the ages of 19 to 35 years old. 1 in 100 children have OCD and 1 in 40 adults have OCD. Obsession symptoms. Obsessions are recurring unwanted thoughts, urges, or images that can cause distress and anxiety. Some examples include contamination and dirt, things that have to be orderly or equal, or being in the unknown. Some other examples include thoughts of self-harm or hurting others, as well as just overall aggression and unwanted thoughts. Compulsion symptoms are behaviors that are repeated to help provide the mind with temporary relief. Some examples include frequent hand washing, cleaning, and frequent counting. Some other examples include following a strict routine day to day and double or triple checking after you've done something such as turning the oven off and locking the door. Diagnosis and treatment history. Psychological evaluations are used as an opportunity for someone to talk about certain thoughts or feelings they may have, as well as obsessions that result in behavioral patterns. This may also require you to reach out and talk to friends and family. Another way to diagnose is through physical exams. Physical exams help rule out whether these behavioral patterns correlate with any other health-related concerns. When it comes to OCD, there are diagnostic challenges. Symptoms of OCD can be similar to symptoms in obsessive compulsive personality disorder, anxiety, depression, and schizophrenia. It is also possible to have another mental health disorder along with OCD. The best solution is to consult with a doctor to get the right diagnosis and treatment. In the 14th century, obsessive compulsive disorder was called scrupulosity. From the cases that were documented through the 14th to 18th century, obsessional fears were often based on religion. Later in the 17th century, obsessions and compulsions were also described as symptoms of melancholy. Some treatment options include psychotherapy. Psychotherapy is when a person with OCD is exposed to their feared object or obsession and learns how to not use their normal coping mechanisms. Medicines are also a treatment option. Antidepressants are usually tried first. These include Prozac for adults and children 7 years and older, Luvox for adults and children 8 years and older, Paxil for adults only, Zoloft for adults and children 6 years and older, and Anafranil for adults and children 10 years and older. Some other treatments include intensive outpatient and residential treatment programs and transcranial magnetic stimulation. Methods used in the classroom for children with OCD. Specific seating arrangements. Having the child seat in an area of the classroom that will help prevent OCD triggers such as loud noises, frequent movement, etc. If the school has noisy hallways, it might not be in the child's best interest to sit by the door. A better option would be for him or her to sit in the front, where they will be less able to hear noises and can stay more focused on their work. Another method is breaking up homework or assignments into chunks. If a child tends to get overwhelmed looking at a whole page of questions, try breaking up the questions onto different pages to try and keep the child's focus. And finally, planning a safe space. Try having a plan in place where if a child starts to feel symptoms coming on, she or he can notify you and go to a safe space to calm down. This can help prevent a blowup of symptoms in the classroom.